Hi, how are you? Oh, uh, it's been a long time. I'm not speaking here, so uh, it's like more than 20 days break, right? So I will discuss some of the things, and it I thought a few of the times previously, but recently, just now I was watching the funeral ceremony of George Floyd. So it created few of the questions in my mind that I saw in my country, in Bangladesh. So I'll explain those things. First, uh, I tell you one thing that I watched one video in YouTube of Barack Obama that he was telling that, and also in CNN, in another video, news that one psychologist was teaching, telling the way how to explain what is protest to the kids. In that motivation, few days back, I taught what is the meaning of protest to my son. Okay. So now, in relation with that definition, today I watched one video in YouTube. There, Obama was telling that protest has some good impact. That is, it teaches and tells or instructs the authority or the governors that there is some wrong is happening. You take care of that. And what is the outcome of the protest? That is, protest will give you the problem identified, and based on that problem, you know what can give you a solution. So in that, you can create some new laws, some new rules, and create some policies which will help you to resolve the problem. So in that case, protest is not a bad thing until it is very much violent way, which is destructing or destroying human life, destroying the properties. Other than that, protest is a very good thing, and it should be non-violent, right? So now, with that type of thinking, something I found that in this case, George Floyd, I saw that it's not a correct thing what happened with him, right? But with this context, when I see the news, I was just thinking, and I was quite busy few days with my programming because I hosted my web portal e-commerce site again, that is www.deshihatbazaar.com. Anybody who want to post something to sell your ad somewhere, to sell your products or services, put it there. It's completely free, so you can sell your products over that portal, deshihatbazaar.com. Now I come to the point again. Okay, that's why this is a break that I can come in to this screen. So I tell you that when police violence is around the world, is talking a huge hot topic, right? And people is angry. I saw a few of the videos which is creating very anger. But behind the scene, you have to take care what actually triggered such situations, right? What is the system gaps which creates this type of violence? So I will not focus on that area, but I will focus in some area which I saw. I will explain something because I worked in life science. I worked in to providing some softwares in our country, health ministry. So I see that, for example, when you publish the product prices of the medicines, the corruption is a bit less because people can check it out in the portal. There was the price, exact price of that medicine. For example, metformin, how much it is. So shops or pharmacies cannot overcharge you. They cannot be corrupt. So in that way, I give you some examples. That is, now I'll talk about some industry which is related to the healthcare, and that type of patients are created because of some other type of business or corrupt incidents or activities that people do who have authority, who have power, as well some businessmen who are black. Okay, now I tell you. For example, there should be, I tell you one thing. First, I identify the problem. It may take a bit longer time, this session, but if you have interest, please carry on to listen it or watch it. You will get some good idea about the industry and the problem that I will tell you now. And it is related to the humiliation. It is the violence of human rights. It happens in such areas of the society. Okay, I tell you. And this is also violence. Okay, so I tell you, that is, for example, people who are mentally sick has a variety of disease symptoms. Some are mentally sick because of the neurological problem. Some people are sick because of the addiction, abuses, and other intakes, which is not creating bad impact in their brain. They work wrongly, act wrongly, and as some habits, they do it recurringly every day in a way which doesn't matches his healthy lifestyle, and with inside the society where he lives, it doesn't. The society don't accept this. Okay. Now, I explain you some more detail from this point. But this type of sick people, how they become sick, and why it is very difficult to overcome the sickness, and what is the treatment is very much required for them. Now, if you consider that an addict patient, so I worked in PsyOps as an MIS advisor, so we are providing policies from the USAID because they have long experience working around the world, and they know which is better. If we apply in any country, it will work for the people, and people will get the better benefits. Okay, so in that case, 12 softwares USAID introduced in health ministry. From that context, when I observed the such patients and their treatments, I found some gaps over there. Okay, now I will explain that. And if you consider gap in a specific context, specific stories of individual persons, you'll find that there is a serious level of violence out there, which is more than a police violence, and which is a very much business oriented, which is no more a treatment anymore in certain cases. Okay, I tell you, that is, for example, such clinics, I'm talking now going to the healthcare organizations. For example, the patient who is sick for drug abuse, substance abuse, or other type of abuses. Now, in our country or anywhere in the world, such type of substance is not legal. So, how are you going to treat the patient? Is he gonna be treated as a criminal or a patient to be treated in a normal way? So two ways out there. Now I saw that there is a bunch of hundreds and hundreds of clinics has been developed in this country to treat such patients. Okay, how do they are getting the license without following the proper process and proper infrastructure? I am very much shocked at it when I go to see that. Now come to the point, next point. This number one problem, that is, you provide the clinics, you don't have proper infrastructure, and certain type of patients, how they are required to be treated, you are not doing that, but you are running on and carrying on the business. This is one fault. Second is information management can be properly managed and can be resolved. This issue which I will tell now. That is, for example, you are a substance abuse patient, and nowadays I saw that this type of clinics has created some programs. Okay, 3 months programs, 6 month programs. It's a research project so far, I think, over a guinea pigs. So, for example, what they do actually, I see. For example, I watched one clinic, that is what they do. They have a program of 6 months. Okay. Now, after the 6 months, if the patient is cured, it's good for the patient. But after that, if he come back into the same addiction process in his once he is back to his home, what they will do? They'll bring them back there, and as a review patient, they're taking him 1 month or 1.5 months. Okay, so there's one example of a clinic where he already admitted for 6 months. After that, for review, he is doing it again 1 month. After that, he's released. After 6-7 months, if he's again started practicing, he is again admitted for 1 month. Okay, that patient, after doing the 6 months, if he goes to the another clinic, because of many reasons can be there, might be he is not liking that clinic, he has been relocated, now he has been admitted in another clinic of the similar type of treatments which they provide. So now they are telling that since he is a new patient, we'll treat him as a first time comer, so he has to do the program again 6 months, then he will become a review. So there is a gap in the synchronization of the patient information. Okay, so it means that if one clinic you are registered, it means in there it's a type of registration also. For I see that if you are registered, in first you have to do the program, after that you will be considered as a review. And if you change the clinic, you have to start the foundation course again, like 3 months, 6 months, then you can be termed as a review. So if the patient-centric care is considered, they should have a synchronization. There should be a communication between the doctors in those two clinics. Otherwise, it should be termed as a business process. Because if you have the proper plan based on science that he needs a 6 months rehabilitation, after that, if he relapse, we can give him 1 more month. But if it is a business process, whenever you go to the clinic, it will start from the beginning. But if he goes to the first one, it will be treated as a review 1 month. So if it is a treatment, somewhere it is again starting 3 months and somewhere it is 1 month, so it's not a treatment anymore, right? Because there is an information gap in between there. And even if it is told and provided that it is already he has done over the previous clinic, they don't accept it. So it is actually not a treatment anymore. If you consider this way, that the first come first serve, and the first term is the first foundation course, and if you change to other one, your previous foundation course is not considered, right? So but in other medication, in other medicines or anywhere, they check the previous documentations, and based on that they take care of the further medications or further investigation, right? So previous investigations or medications are never overcome or overlooked, right? So there is a gap. So how to resolve the gap is to make a centralized system where every clinic must has to be connected with the other one throughout the country. Otherwise, these patients, for smaller faults, at times they are losing time, their lives in their life, they are losing 3 months, 6 months, 7 months, 8 months, right? Again and again. But might be their relapse was for several times or for several weeks, but they are getting punished from the beginning how they were, right? This is one thing. So information system is required. Second is to overcome the infrastructure issue. Like you have license of a rehabilitation. So if some clinic gives a higher quality of facilities which is required for such type of treatment, and other one don't have, so why do you give them the recognition or the license to do that? So in the same information management system, there should be some criteria that you must have these things to operate such business. Otherwise, you don't get a license or audit every several months or years. Next is, it will overcome the quality of the treatment. Next is, when you talk about the deficiencies of their infrastructure or facilities, they are referencing to the other clinics which is even brutal than them. they're telling some guy, I heard when I checked that some guy is telling that if you go there, sometimes because of treatment, they tie with a rope some patient and put the whole night inside the toilet. Okay, then in some place when you enter for the checkup, that if you have something or don't have, some clinics are quality, they will search you with much manner, and some will put off your all dresses in front of 5, 6, 7 people, and they will joke with you. So what type of difference you can find in between the clinics? So they must be punished and should be removed the license. At least audit should be there. Then the quality of their service, not the infrastructure, the quality of their staffs, managers, doctors, nurses. Now, you open a clinic. Some clinic don't allow to bring the telephone with smartphone with cameras into the clinic area, and some they are drawing pictures like patients are out there. They are doing, for example, what is that called, the occupational therapy. They are drawing pictures. They are cooking. They are drawing pictures. It's not an area to draw pictures and doing picnic. If you tell that is a treatment center, and if it is a process how to establish discipline in a personal life, then when you tell that after 10 you have to sleep and 6 you have to wake up, then you cannot wake him up at 2:30 to bring the bed sheets for your own staffs. Is a violence of your discipline process that you have set already, right? This type of discrepancy I have found that some of the clinics don't have that infrastructure. They, in terms of food, there is corruption. Like their staffs are so much illiterate. Not like they are not even a graduate. Graduates far, but they're not even past the school. They have met staff. They have put their provider. Their duty is to bring the raw materials for the cooking for 20, 30 patients. They're doing cheating there. And for example, when patient grows, their food supply doesn't grow at times. When it is asked, they're telling that it is rehab. You have to consider that this is rehab. It is not a place to enjoy. So it means if you establish the proper discipline, you bring it there. So why don't you provide the proper food? Why do you bring the camera inside there? You have to be proper fast, then you try to teach someone what is proper, right? So in this way, there is a lot of discrepancies. Gaps out there in such industry, the treatment process. Somewhere there is 30, 40 patients. They have only one doctor, which is not readily available. Next, for example, if it's a rehabilitation center, it's not a jail, right? If it's a jail, I can consider that the patient is not treated properly. But you bring him as a patient to teach him what is the regular life, how to do that. But when he is facing illness, you are telling that we have nothing to do, you just accept this. Like one example, for example, someone has tooth problem. Someone's tooth is broken based on the bad food of the continuous 1 month. Someone has other issues, but they're telling that we cannot take you outside to treat yourself by taking you to a dentist because it's rehab. So in that case, if you don't have that much facility that in emergency you cannot take your prisoner into the doctor's house, why do you establish such a type of centers only for business? Next is, if in the proper disciplined life, sports is a part, recreation is a part, then why in a 7 days people cannot even see the light of outside? All of the windows are closed with metal sheet. You cannot see outside a single bit. You have to move around in a single floor or the upper floor or the ground floor. But you can never see the sky or the outside weather, you cannot enjoy. So if it is a rehabilitation process, you have to provide that much facility that it can grow in a normal environment how it should be, the settings. It should be the same settings. But it should be a bit controlled, because his problem is the abuse. It is his problem. He has come to get a rehabilitation to create a new lifestyle with a proper discipline. Is for creating the body clock that this time you should do this, after that do this. But in the normal situation, for that body clock, they will get a different environment, the normal environment. If you cannot provide the normal environment with constant control, which you should provide in your clinic, why do you do that? You should not open such clinics, right? So this type of business, and next one I have to mention one thing, that the kidnapping. That is, I saw one guy while talking with him that he's telling that his children who are elder now, he's an old guy, sent him there for 3 months to teach him that he don't accept that his daughter married outside boy as her husband. He don't accept that, so they send him there. It is his voice. Okay, so the children, they send their father to the rehabilitation center in a locked apartment for a longer time to teach him that how hard is life. So he will realize that it is their life, he should accept that. But the process should not be like this. Then I feel that when the catching team, they named it, comes to a house and kidnap a guy who is has problem with the drug abuse or anger management. So now there should be valid reasons for anger, right? Anger is good. A lot of people do get angry, and which is beneficial for them and for the society. It has evidence, and big people told that. So in that case, without knowing the actual status and the facts, you come and suddenly catch up some guy based on anger. It's a violation of the law, I think. So I think every catch-up team should be accompanied with a police authority, along with the area where you will do the kidnap. That area representative, public must be there, along with the one lawyer should be there, human rights official should be there. Otherwise, there is a lot of human rights violations going on through these catching teams. This type of violence must be stopped. It is more than a police violence. A simple death has created a lot of anger over the people throughout the world. And when such people, innocent people, based on property issues, the shares of the business issues, the competition in power, politics, business, they are creating issues and they're kidnapping the victims, and they don't get the service from the lawyers, human rights officials, public officials. Nobody knows that even. And when he is caught and longer time he is kept over those 2-3 rooms, their mental psychology goes down. After coming back, they feel that, oh, I get freed. At least I get freed, so I don't need to talk about this and let the authority or the human rights people know that. So I was just watching the funeral, so it created me some thoughts that if violence, which is a death, is that much crime and create anger over the people, such prisoners innocently who are kept longer time, and for the gap of the information management systems, they are 2-3 months, 4 months, they're getting prisoned like in such rehabs for extra months, is a type of violence of human rights. Is the control of the business process of those clinics. They should be very much audited. There should be very much support from the people who create such policies and create such softwares. And it's not only in Bangladesh. I don't know the other country's status, But in Bangladesh at least, those all clinics need to be operate under a single information management system or distributed system which can communicate each other to at least the patient demographic information and other patient data should be centralized for such patients. It's a special area and industry, and it's related to the security of the country also. So this type of information system, the infrastructure status and the assets of those clinics should be monitored, and database should be managed to understand their accountability to perform in a higher quality process. As well, people should be very much the other things that I told, that when the catching team is involved, there must be some audit out there. Together with them, human rights law agencies and the public officials, then the police nearby the current area stations must be together coming. Otherwise, they tell that we inform them, they know that. And another one more thing, that is when you take them to the such centers, your objective is to teach them life skills, how to cope up with such things. And when you deploy the teachers or the people who teach such things, their voice is without the slang words, they cannot talk. What are they teaching to the people about the rehabilitation? I don't understand. When they, for example, if I cannot tell it like this, that someone is big, someone is small, and this type of teachers should be removed. I think they are no more qualified to operate in such a position in a clinic where people are going and they are brought inside there to teach them the life, to create a body clock, to teach the discipline. So the guy who's have if he talks 3 minutes, out of 3 minutes 20, 30, 60 times he puts slang words. So what type of learning you are getting from him? Okay, and the managers same quality. I saw that they're very much aggressive, like it's not a type of teacher we can expect in a clinic, right? And they say that it's not a clinic, it's a rehabilitation center. So if it's a rehabilitation center, come into jail if you try to operate in that way. And if it's a rehabilitation center for you are taking money and you are telling that it's creating a better lifestyle, you are treating them, so improve your staff quality. That's it. Thank you very much. It's Time Pradhan here from Peak 945. Bye bye.